I grew up in Manchester, in England.
Yep.
And I went to medical school in Edinburgh, in
Yep.
Scotland. And then for the last 14 years or so, I've been practicing cardiology and worked as a cardiologist in London.
Yes.
And in that time, over, say, the last 10 years, I've done a lot of research on looking into the causes of how heart disease develops and shifting the paradigm, the understanding of heart disease. Focus a lot on lifestyle, but in that process, Tucker, I have realized that a lot of the information that doctors receive when it comes to clinical decision-making has been corrupted by vested interests, in particular big pharma in this particular discussion. But interestingly, at the very beginning of
I'm sorry to interrupt.
Yeah.
First of all, it's interesting to hear a practicing physician say that. And I should also tell our viewers that you've been involved in discussions about public health in Great Britain, not even just about cardiology, but about obesity and lifestyle, as you said. So you've looked at this carefully. When did you conclude that pharma or these organized interests were affecting medical decisions?
Yeah, it's a great question. So I qualified as a doctor in 2001. So I've been a
Yes.
practicing doctor for over 20 years. And what I noticed working the National Health Service, Tucker, over many years, was more and more people were coming in with chronic diseases, multiple conditions. They weren't getting better. At the same time, we're hearing global news from the WHO in 2004 about obesity being a global pandemic. And I tried to then understand what was going on. And for me, certainly about 10, 12 years ago, I looked at the situation and thought, if we don't get on top of this, our healthcare systems are going to collapse. So we're already under a lot of pressure. So I started to investigate what was going on. And for me as a cardiologist, my primary interest was in heart disease. And despite all of so-called modern science, we had never really made big inroads into tackling heart disease or certainly eradicating it. So my original research was to look into the heart disease issue. And in that process, I learned very quickly that the original paradigm around high cholesterol and the prescription of statin drugs, which is one of the most lucrative drugs in the history of medicine, was based upon very flawed science.